Am I audible and visible visible to you? Okay. So, myself, Dr. Shital Ghataliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I am educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. With iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, you can have a various resources like well-structured live batches, recorded classes, competitive live tests and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lecture from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now there are special class feature. Now the classes will be highly interactive. There will be a facility of poll for the learners. There is also a facility of raise a hand. You can interact with your educator now. You will never miss a class because Unacademy will send you regular notifications. You can even have a lecture notes. You can download it. You can have access to the recorded sessions. You can attend the class anytime, anywhere. As I told you, there is a plus batch test rituals. You will find NEET PG 2022 subject-wise test series, NEET PG 2022 grand test series, and many more. So there are two batches: Focus FMG 2022 comprehensive batch, 6-month duration, already started from 15th of December. Target NEET PG 2022 test and discussion batch, duration is 3 months, already started from 15th of December. So both the subscription, iconic subscription and plus subscription, both are available with various duration and different prices. You can use the promo code Shital10 to get additional discount. As I told you, there is a free test on Unacademy. Educator to curated test series is there. Different scholarships are available for different ranks. You can check with the time and date and different subjects. You can use the code Shital10 to unlock the free test. You can use the code 872878 to join the quiz with application. There is a special Republic Day offer, 6-month extension on the app, which is applicable on 1 year or above plus subscriptions. Use the code Shital10 and get additional 10% off. Now come to today's topic. That is image-based general physiology. Okay, so I am starting with the image-based question, that is homeostasis. Homeostasis. Homeostasis means maintenance of constant and stable internal environment of the body. To maintain the homeostasis, there are feedback mechanisms. There are different feedback mechanisms, negative feedback and positive feedback mechanisms. Negative feedback, see the word here. In the hypothalamus, there are releasing hormones. From the hypothalamus, releasing hormones are released which reaches to the anterior pituitary. Okay, for thyroid hormone, there is TRH, thyroid releasing hormone. Okay, this will reach to the anterior pituitary by vascular connection. It will reach to the anterior pituitary by vascular connection. Okay, hypothalamus and anterior pituitary, they are attached. They are connected with each other by hypothalamo-hypophyseal portal vessels. So when the releasing hormone TRH, okay, thyroid releasing hormone is released, it reaches to the anterior pituitary by vascular connection. From anterior pituitary, there is a release of stimulating hormone. Okay, TSH, thyroid stimulating hormone. Okay, that stimulating hormone will reach to the thyroid gland and it will cause release of various thyroid hormones from the thyroid gland. Once T3, T4 are released in the blood, then released T3, T4, it will cause inhibition of anterior pituitary and hypothalamus. Okay, for further stimulation. Okay, it causes inhibition at hypothalamus level, so no more release of TRH will be there. It causes inhibition at anterior pituitary level also, so no more TSH secretion is there. So by this inhibitory negative feedback, it maintains the normal T3, T4 level. It maintains the activity of the thyroid gland, which releases the thyroid hormone. Okay, so here the response generated is release of the hormones. Release of the hormones. This is the response, right? And stimulus is TRH release and TSH release. So released hormones from the thyroid gland will causes inhibition of anterior pituitary and it also causes inhibition of hypothalamus. Right? So both are inhibited. So further secretion of it will be controlled, right? So this is the negative feedback mechanism, example of negative feedback mechanism. Now come to the another feedback mechanism. This one is a positive feedback mechanism. Okay, understand the word carefully. Positive feedback means feedback is positive. Okay, so it means here the initial stimulus which generates the response, that generated response will cause further stimulation. It promotes the more and more stimulation, causes more and more stimulation. So it will cause a strengthening of the response which is generated. Right. So example of it is clotting mechanism. Now here what will happen? Whenever there is any tissue injury, whenever there is any tissue injury will cause the damage to blood vessel, right? Or if there is anything inside the body which causes erosion of the endothelial lining of the blood vessel. So damage to the blood vessel, it will cause activation of various clotting factors. Okay, once different clotting factors are activated clotting factor will cause further activation. It will cause further activation of the clotting factors. Okay, so that way it increases the size of the blood clot, which will plug the site of injury, and it prevents the blood loss by formation of blood clot, adequate sized blood clot. Okay, so that is example of a clotting mechanism. Whenever any tissue injury occurs, or if there is a damage to the endothelial cell lining of the blood vessel, or if the blood vessel itself is injured, okay, so any tissue injury which causes damage to the blood vessel, it will cause activation of the various clotting factors by the activation of different clotting pathways. These clotting factors, activated clotting factors, will cause further activation of the clotting factors and causes formation of the blood clot, which plugs the injured site and it prevents the blood loss. Then another example of positive feedback mechanism. Good evening, happy to see you. Another example of positive feedback mechanism is uterine contractions during labor. See the image carefully, uterine contraction during labor. So here what will happen at the time of labor, when the head of the baby starts stretching the cervix, okay. So stretching of the cervix will send impulses to the pituitary, posterior pituitary. Okay, from the posterior pituitary there is a hormone oxytocin which will be released. Okay, posterior pituitary, it will send the signal to the posterior pituitary and it causes release of oxytocin. Now the action of the oxytocin is it will act on the uterus and it will cause contraction of the uterus. So whenever the released oxytocin will act on the uterus, it will cause contraction of the uterus. Okay, so increase is the uterine contraction. Increase in the uterine contraction will cause pushing of the baby down. When the baby goes down, it causes further stretching of the cervix. Further stretching of the cervix will again send the signal to the, this entire cycle will be repeated. Okay, it will again send the signal to the posterior pituitary. From the posterior pituitary, hormone oxytocin will be released. Oxytocin will cause uterine, increases the uterine contraction. Okay, it will increase the uterine contraction. So this way it helps in the pushing of the baby down, and this way it will help in the delivery of baby. Okay, that is called as parturition. Okay, or you can say delivery of the baby. So that is the example, another example of positive feedback mechanism. Okay, it is another example of positive feedback mechanism. Here the stimulus, the response which is generated, okay, it causes the stretching of the cervix. Okay, it causes more and more release of the oxytocin from the posterior pituitary. So it causes more and more uterine contraction which causes delivery of the baby. Okay, so that is the another example of a positive feedback mechanism. This is important MCQ. This is important from MCQ point of view. It is asked even 1 to 2 liner. Write example of negative feedback mechanism or positive feedback mechanism. Different example of negative feedback mechanism are hormonal regulation. Majority of the body system works through negative feedback mechanism. Blood pressure regulation, that all are negative feedback mechanism. So whenever there is a rise in the blood pressure, by feedback mechanism it will be maintained in a normal narrow range. If there is a fall in blood pressure, then again by the feedback mechanism, it will be maintained to the normal range. Okay. Positive feedback mechanism, certain examples are there only. Okay. First one is the clotting mechanism, which I already told you. The another one is a uterine contraction during labor. Okay. That also I explained. Then another one is a impulse conduction. Okay. Impulse conduction in the nerve. Okay, that is also example of a positive feedback mechanism. So this is important image based. This one is image based question. Now this is again important. This is image of cell membrane. Image of cell membrane. See, this is fluid mosaic model. See, the word itself says mosaic. So here what will happen? There is a lipid protein mixture, right? Cell wall is formed of a lipid and protein mixture. Here there are the protein which is there, this one. It will give you the appearance like a mosaic, right? So lipid and protein mixture is there. Now let us see the lipid arrangement first. See this one. Lipid arrangement, there is a hydrophilic and hydrophobic end. See, the word itself says hydro means water. Okay, hydrophilic. Philic means water loving. Okay, so it will face the aqueous part. Aqueous part of the cell. Okay, so on the outer side, it will face the extracellular fluid, and on the inner side, it will face the cytoplasm. Right? This is hydrophilic, so it is water loving. Mosaic is like a tile. It's like a tile. Okay, so it gives the appearance like a tile. See this one? Right? So hydrophobic. Phobia means afraid of, right? And hydro means water. So this is non-polar end, hydrophobic end. Hydrophobic end. So here what will happen? This is water fury. This part is water lipoprotein. This is it function mainly as an enzymes, ion channels, they are mainly lipoproteins. Then glycoprotein is mainly function as receptor. This is important from MCQ point of view. Glycoprotein, protein and carbohydrate mixture. Okay, they are mainly function as receptor. Okay, so the another one is so that is how the protein arrangement will work. There is a carbohydrate arrangement also. The glycoprotein or which is attached to the protein, glycoprotein or lipoprotein, which forms a loose covering. See this one? Which forms a loose covering, which is called as glycocalyx. Okay, loose arrangement, that is called as a glycocalyx. This glycocalyx will help. It will help in attachment of one cell with the another cell. This is important from MCQ point of view. Glycocalyx helps in the attachment of one cell to the another cell. It is loosely attached with the protein. See this one, right? So, and they are negatively charged. Okay, so it will not allow the negatively charged particles to move out of the cell. Okay, another negatively charged particles cannot move out of the cell. It will hold it. Okay, in some cases it may act as a receptors also. So by just simply remembering the image, you can remember so many things, right? So let us understand this entire arrangement. If we look at the entire arrangement, so cell membrane is composed of lipid and proteins, right? These lipids are, it can be cholesterol, it can be phospholipids, it can be glycolipids, right? And proteins can be intrinsic, the inner side. Okay, it can be extrinsic, the one, or you can say peripheral protein, or there are transmembrane protein. Okay, this intrinsic protein will mainly act as enzyme. Extrinsic protein mainly function for the cytoskeleton framework. Okay, it will gives the frame. Then transmembrane protein will mainly act as a pump, carriers, channels, receptors. These functions are carried by transmembrane proteins because it is allowing the substances to pass across the cell membrane. So this way, simply by remembering these image, you can understand that, okay, if this is asked, if you remember this, then by simply remembering the image, you can say that, okay, this is how the lipid molecule will work. Lipid arrangement will be there. Okay, this is how, see the protein part. Okay, this is how the proteins are arranged. So you can imagine that, okay, this way the protein is arrangement. This is the possible function of it. Then carbohydrate. So this way surface protein. So simply by remembering image only, you will be able to write down the short note, that is a cell membrane. Cell membrane itself is a short note. Now come to the next one. See, mitochondria is also a short note. Okay, it is also a short note. See the image carefully. There is outer membrane. In the mitochondria, there is an outer membrane, then inner membrane. See this one, which is thrown into the fold. Okay, that is called as a cristae. Okay, so if we look at the membrane, there is a outer smooth membrane and inner folded membrane, which is thrown into the fold. This fold is called as the cristae. Okay, the inner membrane contains the lollipop's cycle. Okay, it contains enzymes, the ATPs will be stored. Okay, so this is important part. This is about the structure. So ATP is the, you can say, it is the energy currency, right? Energy currency of cell. So, and this is again important question here. It is the formation, the entire process of ATP formation is called as a chemiosmotic mechanism. Okay, chemiosmotic mechanism of ATP formation. Formation of ATP by enzymes which are present in the matrix of the mitochondria, which are important for the Krebs cycle, which helps in generation of ATP, causes generation of ATP. That mechanism is called as a chemiosmotic mechanism. Okay, so this is again important point to remember. So in the knob of the membrane of the mitochondria, mitochondrial cells, okay, there are enzyme for the ATP generation, ADP. It will convert ATP into ADP into ATP, okay, by the enzyme ATP synthetase. Okay, that is called as a chemiosmotic mechanism. So this is all about the image for today. If you have any question, you can ask me. These all images are important and these all are short notes. Feedback mechanism itself is a short note. Cell membrane is a short note. Mitochondria is a short note. Mitochondria, another important feature of the mitochondria, if you see the image, okay, see here there is a DNA. So mitochondria are self-replicative. Okay, this is very important feature of the mitochondria. They are self-replicative. Okay, so they can form another mitochondria, right? So this is very important. These all are short note. Today's whatever I covered, glycocalyx, okay, carbohydrate which covers, that forms a glycocalyx, that is important for the attachment of the cell membrane with the another one. Okay, and this all images are important. If you remember the image, you will be able to write down everything. Okay, ATP are, there is a lollipop like structure in the matrix in the mitochondria, which is attached with the inner fold, which is a store where the ATPs will be stored. Okay, and there is a chemiosmotic mechanism. So by the enzyme ATP synthetase, ADP will get converted into ATP. Mitochondria contains DNA, so they are self-replicative. So one can generate the another one. So this is all about, this all are important. MCQ as well as short note. All are 4 short notes are there, and so many small MCQs, small questions, 1 to 2 liner questions are there. Okay, thank you so much. Thank you. I'm really happy that my students are happy. If you have any question, you can ask me. These all are short notes. Today I covered whatever images, all are short notes. And feedback mechanism is very important. Very important. Okay. Mitochondria is something very self-membrane. They are important short questions, or 1 to 2 liner questions, short note, 1 to 2 liner questions, and MCQ point of view. Everything is important. Okay. So in that case, if you don't have any question, do you have any question? Okay. So I would like to end the session here. Continue with the image-based learning of general physiology tomorrow, same time. Okay, 8 o'clock. Sorry, 9 o'clock. Okay, so tomorrow I will continue the some other images of general physiology. So stay connected, study hard, study with me, and thank you so much for wonderful audience. Thank you. Subscribe Unacademy Future Doctor channel and help us to reach to more and more number of students.